Hello, I'm Stephanie King and I'm from the Murupuni Centre for Rural and Remote Health.
Hi, I'm Fatima. I'm also from the Centre for Rural Remote Health, James Cook University. I'm also from the Institute for Social Science Research, University of Queensland. Today, Stephanie and I will talk about a program that we're running in remote Queensland and focused on capacity building of Indigenous youth workers as sleep coaches.
So firstly, I'd like to make an acknowledgement of country, and I'd like to acknowledge the Kalkadoon, the people who are the traditional owners on the land where we live, work and play in northwest Queensland. And I'd like to pay my respects to the elders, past and present. I'd also like to pay my respects and acknowledge the Aboriginal and Torres Strait Islander people who are attending the conference today.
Thank you, Stephanie. And before we go further, I would like to share that this project is funded by Medical Research Future Fund, Indigenous Health, and I am also an associate investigator at the Yaqoot Center.
So, though there is limited research, but we know from the community interviews and through the community meetings that we had with young people, that there was a significant proportion of Indigenous young people and adults who are struggling with poor sleep. And some of the common sleep issues for young people are insomnia, sleep-related breathing disorders, such as sleep apnea, irregular sleep pattern, and excessive daytime sleepiness. So based on our findings of the recent paper, we can say that there was 2 in 5 young Indigenous children who are struggling with poor sleep. These sleep problems are affecting the health and well-being of Indigenous young people in many ways. And for example, there is a high rate of sleep fragmentation linked with poor reading and numerical skills. There's sleep problems, and which is associated with behavioural problems. There is short sleep and late bedtime, and it's associated with unhealthy weight and increased risk of chronic conditions later in life. There is late bedtime and poor sleep, which leads to increased risk of poor mental health.
So we know there is a problem. There are many young kids who are struggling with poor sleep, and their sleep issues are undiagnosed and untreated, and that is increasing their risk of significant mental health and physical health issues later in life and affecting their academic performance and achievements. What we need to do here is to co-design culturally appropriate sleep health program, and just not focus on sleep, but also integrate traditional and cultural knowledge with the scientific knowledge to make the program holistic. We also need to ensure that there are trained people available in the community who could provide timely intervention. So we need to invest in training and upskilling of Aboriginal and Torres Strait Islander health workforce. And we need to co-develop educational resources and toolkits that are appropriate for the community, that are acceptable and can help young people in embracing sleep health. Through this project, we are co-designing and delivering inclusive and holistic education and training to youth workers to become sleep coaches. We are developing and adapting sleep education tools and resources for sleep health promotion in First Nations communities. And we'll also conduct an evaluation to see whether these education and training activities are effective in capacity building of Indigenous youth workers as sleep coaches. On the right-hand side, you can see an artwork done by community elders. It reflects the program logic. At the corners of the painting artwork, you can see 4 circles that represent the communities outside of Mount Isa we are trying to connect through this program. The core of this program, you can see community elders, service providers, and the research team all working together to help young people improve their sleep. And these footprints represent young people who are wandering all night because of their disengagement with their culture or lack of safe sleeping opportunities at home, or neighborhood issues, or spending too much time on their devices. And these shapes represent Indigenous youth workers as sleep coaches who are trying to connect these young people back with their culture and improving the understanding of sleep health. So everyone is working together, this shared goal of improving young people's understanding of sleep and helping them to get a good night's sleep. As we mentioned before, we are offering this program in Mount Isa, where about 20,000 people live, and 1 in 4 identifies as Aboriginal and Torres Strait Islander person. Of that population, nearly 12% is in the age of 10 to 19 years. And through our previous research, we found that 1 in 4 reported poor sleep. We are offering this program in partnership with the local youth health and wellbeing service, Young People Ahead. And the 2 youth workers that we are training as sleep coaches are recruited through this service. They are working as project officer, and this project is approved by the UK Human Ethics Office. This project is guided by a steering group from community elders, and we have 2 other advisory groups of service providers and Indigenous youth. We are talking to key stakeholders, which involves community elders, service providers, Indigenous youth, their parents and carers, and sleep scientists to develop this training program. And we are also co-designing education and training modules and resources by integrating traditional and cultural knowledge as well as scientific knowledge to develop resources which are appropriate, culturally appropriate and meaningful. These are the 2 youth workers who are getting the training to become sleep coaches. And this is first ever in Australia, so we are learning as we are progressing. The training framework is based on 8 ways of learning model proposed by Yaqoot. This model is not prescriptive, rather it provides a framework for empowering and educating Aboriginal and Torres Strait people using their ways of knowledge transfer and centered around their connection with community, country, their people, and their culture. So as we have discussed before, we are talking to different stakeholders, we are going to different places, we are inviting them to come to our center and share their thoughts and their views on how this training needs to be developed, what elements should go in that training, and how can we develop a workforce which is ready to help young people in reducing their risk of sleep problems or managing or preventing their sleep issues. So we went to services such as Headspace, a local Aboriginal community control health organization, Save the Children, Selectability, and we went to youth mental health service as well. We went to community elders and young people and their parents, and trying to get everyone's views in developing this program. Based on our interactions and meetings, we have co-designed this training. So there are 5 core elements of this training, starting with sleep. So we are providing 2 levels of sleep education to youth workers. The foundation level training covers basic understanding of sleep health, why it's important, how sleep affects our physical and mental health, and what are the common problems young people are facing regarding sleep. And the advanced level training is offered by University of Western Australia, the Centre for Sleep Science. So it covers sleep architecture, clinical sleep problems, screening for sleep issues, and providing CBTI training to youth workers. Through our meeting with community members, we also identified that a lot of young people who will be presenting with sleep problem will also have mental health issues. So we need to cover that as well in the training. So by spending 10 hours on teaching these youth workers to understand what would be the common mental health issues these young people will be presenting with, and how can they help them and refer to services. We are also covering the impact of domestic violence and intergenerational trauma on young people's sleep, as well as the role of alcohol and other drug abuse on sleep health of young people. As guided by community elders, we are keeping this training and upskilling activities very interactive and engaging, and we will be using narrative therapy for knowledge transfer. At the center of this training is the community elder. They are meeting with youth workers every month and ensuring that the focus is on healing through cultural identity and connection with community, clans, and country. We're also spending time on incorporating the meaning of dreaming and connection with ancestors in the program, so that when young people come, we'll talk about their dreams and what it means for them and what role dreams play in emotions processing. So we are trying to offer a training which is really holistic and inclusive and context responsive For sleep education, we know there is no other tool in Australia. So we have established contact with Diabetes Victoria and Victoria Aboriginal Community Control Health Organization. They are using this tool called as Felt Man and Felt Mem for diabetes education in Indigenous communities. And it's a really interacting, engaging tool where this human body is printed on a fabric mat and there are different attachments to represent different body parts. So we have signed an MOU with them to adapt this Felt Man and Felt Mem for sleep education. And this adaptation will be conducted in collaboration with community elders to incorporate Indigenous colloquial terms, traditional knowledge, and visual cues. So this will ensure that when Indigenous youth workers as sleep coaches, when they will talk to young people, they will have this mat in front of them and they can show how poor sleep affects different body parts and how can they improve their sleep health. At the end of the training, we'll conduct evaluation to assess the training effectiveness. We'll collect both qualitative and quantitative data. And the capacity building assessment would be conducted by interviewing the youth workers to assess their satisfaction with the content and delivery of the program, knowledge gain and skills acquisition, strength and limitations of the training activities, and impact of this program at the community and organizational level. We'll also interview the program participant and conduct surveys and focus group to assess whether Indigenous youth workers as sleep coaches were effective and what can be done to improve this program in future. So this project started last year in the first 6 months of the project in July. The progress we have done is we have recruited 2 Indigenous youth workers as project officers. They are based at Young People Ahead. They are knowing more about the community, their role and the problem young people present with. We have sought ethics approval. In the starting of this year till July, we have co-developed the sleep coach training module and other activities around upskilling of youth workers. And from July to December this year, we are hoping to complete this sleep coach training and finish the development in the adaptation of educational resources. The program will be offered next year in January, and then we will conduct evaluation of the youth workers training in sometime in July next year. So this will be a 3-year project, and we are very keen to know what is the community response to this project and whether young people see any value in this work. So if you have any more questions regarding this project, please feel free to email me, and thank you very much for your time. Thank you.